My supervisor's just asked me to do a health assessment on Millie here, and then just go ahead and give her routine ear drops just to prevent any ear infections. Now, Millie here, she's a small apricot cavoodle. She's about 11 months old, and she's a pretty friendly, pretty sweet dog. And she listens well to instructions, so she should be making this process pretty easy for us. And from an initial distant review, she seems to be quite healthy. She has normal gait with no signs of limping or any sort of struggle to walk, and doesn't seem to be showing any other obvious health concerns. Alright, so just before we begin anything, we're just going to go and grab all the items that we're going to need for this task. So that'll be our gloves and face mask, a towel, a lead, disinfectant paper towel, and our eardrops. So now we're just going to use our lead and we're going to transport Millie from our holding room over to our exam room. And then we're going to lift her up onto the table. And just before we begin with our assessment, we're just going to put on our PPE. So that'll be our gloves and our face mask, just to reduce the risk of any possible zoonotic diseases being contracted here. And so now that we have our PPE on, we can start with the assessment. So we're just going to begin by first off checking for any discharge or any other abnormalities in her eyes, her ears, nose and mouth. And just remembering to be extra thorough with her ears, just because cavoodles are known to be quite prone to ear infections. But so far she seems to be all good and healthy. Her eyes are clear and bright. Her ears are nice and clean. No mucus or discharge coming from her nose, and her mouth seems to be having no excessive tartar built up there. And so now we're just going to move on to the hydration assessment. So we're just going to pinch that bit of skin on the back of her neck there and just see how long it takes for it to drop. And as you can see, it drops pretty quick, so she seems to be well hydrated as well. So we're just going to write that down. And then we're going to take her temperature. So we're just going to place our hand on that bit of exposed skin just under her belly. And everything seems to be fine there. And here we're just going to have a look at her mucous membranes and do her capillary refill time. And her mucous membranes seem to be all good and healthy, nice and moist and pink. And her capillary refill time is no more than 2 seconds. It's about 1.5 seconds there, so everything seems to be good. And just having a quick look over the top of her body, we can assess her body score. I would give it a 2.5 out of 5. She does seem to be slightly on the lower side of the scale, but she does seem to be a pretty healthy weight. And so now we're just going to assess her circulation. So for that, we're just going to find her femoral pulse. So we're just going to place our fingers on the inside of her hind leg and then count the beats in a short 15-second period. And then we're just going to multiply that number by 4, and we should get her beats per minute from that. Now we're just going to start counting when the clock hits 5, and then we should be good when it hits 8. And so the beats in that 15-second period was about 31 beats, so that should be 124 beats per minute. And now we can go ahead and assess her respiration. It's going to be a similar process, just this time we're going to be watching her chest and just counting each breath expiration in another short 15-second period. And then we can take that number, multiply it by 4, and we should have her breaths per minute from that. So we started counting when the clock hit 3, so we should be good when the clock hit 6. And her breaths in that period was 6 breaths, so her breaths per minute is 24. Now that we've finished the health assessment, we can go ahead and give her her routine eardrop clean in order to prevent any ear infection, just because cavoodles are known to be more prone to ear infections because of their floppy ears just not allowing enough airflow into the canal. So what we're going to do here, we're just going to put 3 drops into each of the ears, and then just start massaging the ears after, just to allow the drops to be properly absorbed into the canal. And then once that's finished, we can go ahead and take her back out to our other holding room. And now that everything's done, we can just go ahead and take off our PPE and just chuck that in the general waste bin there. And then we can start cleaning up our exam room. So we're just going to grab that towel there, quickly take that to the wash, and then we can grab our F10 and our paper towel, and we can start wiping down our exam table.